This video is about penile prostheses. The best of them are so advanced, they behave like the real thing. You can have reliable erections anytime, anywhere. It is even technically possible to moderately enlarge the penis through prosthesis insertion. More in this video, but picture this. You have met that super hot girl on Tinder and the date is going the way you want it to go. You stand in front of her, reach down in your pants and start pumping. That can be quite embarrassing. If you are toying with the idea of getting a penile prosthesis, it's better you know about some of the downsides because a prosthesis is not the real thing after all. And even if it is a safe surgical procedure, there are also some health risks involved. In this video, I'll be giving you 4 reasons why you should be concerned about getting a penile prosthesis. In case you're wondering who's talking, my name is Dr. Stefan Buntrock. I'm a board-certified urologist and specialist in sexual health. So, how does an inflatable prosthesis actually work? It consists of 2 inflatable cylinders. These can be filled up with fluid to mimic an erection. The fluid comes from a reservoir that is anchored inside the body close to the bladder. With a small pump in the scrotum near the testicles, you pump fluid from the reservoir into the cylinders. Attached to the pump, there is a tiny button that you can push to make the fluid flow back into the reservoir. From the outside, you don't see a thing and you can get an erection within seconds. That's the beauty of it. But here are some things to consider. Downside number 1 is that it is a decision for life. Prosthesis placement will permanently damage the function of the original corpora cavernosa. Should you regret your decision once the prosthesis is in place, you can't make this damage undone. This is why shared decision-making within the couple is important. If the partner disagrees, you have a crisis on your hands. I didn't make that up, it has happened. However, is it possible to get a longer and girthier penis as a bonus? Everybody wants to get a larger penis. And I want to get a larger channel. This is why I'm working hard to keep you informed on urological topics twice a week. If you like my content, please give me some applause and hit the like button now. Also subscribe to UroChannel and share this video. It's a way to show your appreciation and it doesn't cost you time or money. Thank you. So, can an implant make the penis larger? Within limitations, this is possible, yes. During the procedure, the surgeon can carefully place the largest possible prosthesis the individual penis can safely accommodate. There are special prostheses like the Boston Scientific AMS 700 LGX that offers an increase in girth and length of up to 20%. Naturally, depending on the individual anatomical circumstances and possibilities. But even after prosthesis placement, there are reports in the literature where plastic surgery has been able to increase visible penile length. Downside number 2 is complications. Getting a penile prosthesis can be life-changing for men with severe erectile dysfunction, but like any surgery, it comes with risks. Modern implants are safe, but some complications can still happen. Surgery may cause excessive bleeding with subsequent bruising and swelling. The urethra may be damaged during the procedure, which would be a severe complication. After the surgery, the implant may turn out to be too short or too long. If it is too short, the tip of the penis will not get hard, but stay soft and wobbly when the implant is activated. If the prosthesis is too long, with time it may eventually come out at the top of the penis. However, this is not commonly seen. In 1 to 4%, there may be an infection. Commonly, the prosthesis will have to be removed. In rare cases, particularly in patients with prior pelvic surgery or scarring, the reservoir can put pressure on the bladder, leading to complications. However, this is uncommon with proper surgical placement. Penetration of the pump through the scrotal skin may also be seen sometimes. Even in the most experienced hands, complications can happen, and if they happen, they can become a big mess. Downside number 3 is wear and tear. Like any medical device, a penile prosthesis has a lifespan. Most last around 10 to 15 years depending on use, and will eventually need replacement. I saved the most important point for last. Downside number 4 is exaggerated expectations that a prosthesis fully restores natural sexual function. After all, it is not the real thing, and even if erections become reliable, they may not be as expected. In some cases, orgasm may be compromised after prosthesis placement, and depending on surgical technique during the procedure, sensitivity issues may arise afterwards. This means if you are thinking about getting a penile prosthesis, you need thorough preoperative counseling on your personal circumstances to determine the right type of prosthesis and whether it could be the right thing for you at all. Did you know that I have a playlist with over 140 videos on the penis? Here's the link. Check it out. Thanks for watching. Bye bye.